Let's go over TNF-alpha inhibitors, starting with etanercept. Etanercept is going to act as a decoy receptor for TNF-alpha, and TNF-alpha is falsely going to bind to this decoy receptor. As a result, it's not going to be binding to its actual receptor, and so TNF-alpha is not going to have the effects that it normally has because now it has bound to this false receptor. So in general, TNF-alpha inhibitors are going to function to inhibit TNF-alpha, which is going to be a important cytokine that is going to upregulate the immune system. So the function of TNF-alpha inhibitors is to downregulate the immune system. And so it is used in autoimmune disorders. The three diseases that etanercept is indicated for are going to be psoriasis, rheumatoid arthritis, as well as ankylosing spondylitis. So let's go to the next slide and talk about the four direct TNF alpha inhibitors. So these are going to act as a monoclonal antibody against the TNF alpha. And these drugs are golimumab, certolizumab, adalimumab, and infliximab. These drugs are going to bind to TNF alpha, so they're going to act as a monoclonal antibody and they're going to inhibit the functions of TNF alpha. And so, one important distinguishing factor between these four drugs versus etanercept is that these drugs are going to be associated with something known as anti-drug antibodies. So, these anti-drug antibodies are going to be produced by our body against these drugs, and as a result, it can decrease the effectiveness of these drugs. The four diseases that these drugs are commonly indicated for are going to be inflammatory bowel disease, as well as the other three diseases that we talked about with etanercept, which includes psoriasis, ankylosing spondylitis, as well as rheumatoid arthritis. Now, one difference in these drugs is infliximab. So, infliximab is not going to be used for psoriasis, unlike these three, and it is going to be the only TNF alpha inhibitor that is going to be used in Crohn's disease. And all TNF alpha inhibitors, including etanercept and all of these drugs, are going to be one of the side effects can be drug induced lupus. So, just as a summary, TNF alpha inhibitors can be used in the treatment of psoriasis, inflammatory bowel disease, rheumatoid arthritis, and ankylosing spondylitis. As we said earlier, infliximab does not treat psoriasis. Only TNF alpha inhibitor that treats Crohn's disease is going to be infliximab. Anti-drug antibodies are going to be less likely to form in etanercept, and etanercept is going to be indicated for psoriasis, rheumatoid arthritis, as well as ankylosing spondylitis. And in general, TNF alpha inhibitors can cause drug induced lupus, so this is something to watch out for.